Want to hear a crazy fact that most parents never hear? Within the first year of life, your baby's brain will double in size and form over 1 million neural connections every second, making this the most critical period for neurological development they'll ever experience. Yet conventional pediatric care focuses only on whether babies hit basic milestones within broad timelines, completely missing whether their nervous system is actually functioning optimally. And milestones are important, but let's start looking at them from a different perspective. This video is for parents of babies who, in their first year of life, who sense something isn't quite right with feeding, sleeping, or development, and those who want to ensure that they're giving their child the strongest possible neurological foundation from the very beginning. We're going to reveal why hitting milestones on time isn't enough and how the perfect storm of early stresses can create lasting neurological patterns that conventional medicine completely overlooks. You'll discover the hidden significance of your baby's early milestones and how to recognize when your baby's nervous system needs support during this critical window. So, ready to get a little nerdy? Well, according to the Harvard Center on the Developing Child, the first year of life represents when neuroplasticity is at its peak, one of the most rapid periods of brain development in human lifespan. During this time, your baby's brain undergoes extraordinary neuroplasticity with peak synapse formation, creating the fundamental architecture that will influence every aspect of their health for the rest of their life. Yet here's what's happening in pediatric offices across the country. Parents express concerns about feeding difficulties, sleep issues, excessive crying, or developmental quirks, only to be told these are normal variations or advised to wait and see if the child outgrows them. This approach completely misses the critical window when neuroplasticity is at its peak and gentle interventions can have the most impact. A baby can technically pass the developmental screening while compensating for underlying neurological dysfunction through tension patterns, asymmetrical movement, or skip development stages that will impact them for years to come. So, your baby's ability to breastfeed effectively is actually their first major neurological test, requiring coordination of multiple cranial nerves, upper neurospinal alignment, and precise timing between the nervous system and neuromuscular coordination. When we see feeding difficulties like shallow latch, frequent popping off, grasping during feeding, or a baby who becomes excessively exhausted while eating, these are often early signs that the nervous system needs support. Head control development between 8 and 12 weeks indicates proper cervical spine and deep neck muscle development. While challenges like persistent head turning to one side or difficulty with tummy time can signal early neurological dysfunction. The most neurologically significant milestone is crawling between 7 and 10 months, which establishes cross-pattern movement that stimulates balanced development of the corpus callosum, building foundations for later skills like walking and reading. Multiple stressors can accumulate and overwhelm a baby's developing nervous system, creating patterns of dysfunction that persist long after the initial stressors have passed. Prenatal stressors include chronic stress during pregnancy that affect fetal brain development, while birth interventions like Pitocin induction, forceps, vacuum delivery, and C-sections, and positioning issues can place significant pressure on the baby's neck and head. Environmental stresses like after birth, like development, disrupted sleep patterns, overstimulation, early antibiotic exposure, and feeding challenges continue to stress an already vulnerable nervous system, pushing babies into sympathetic dominance where they get stuck in fight or flight mode. Now, your pediatrician might check off that your baby can roll over at 6 months, but that's not assessing whether that rolling movement is symmetrical, coordinated, or built on proper foundational development. Conventional pediatric care consistently overlooks the assessment of subluxation and dysautonomia, the neurological interference and imbalance that can develop from the perfect storm of stressors. These functional problems rarely show up on standard tests, but can profoundly impact how well your baby eats, sleeps, develops, and regulates emotions and behaviors. We use advanced insight scanning technology to objectively assess your baby's nervous system function through gentle, non-invasive scans that measure heart rate variability, muscle tension patterns, and temperature regulation. These scans give us a clear picture of where stress and dysfunction exists in your baby's nervous system, showing balance, symmetrical patterns in healthy infants, or areas indicating stress and need support. Rather than waiting for problems to develop, we take a preventive approach, supporting optimal nervous system function from the very beginning when neuroplasticity is at its peak. If you sense in your mom or dad gut that something isn't quite right with feeding, sleeping, or development, and you want to ensure as a parent the child has the strongest possible neurological foundation from the very beginning, click the link in our bio to learn more about neurological development.